So we've gotten through 4, so let's do 5 and 6 and see where we go from here. Adverse effects, interactions, and contraindications. Now, as you're looking at Chapter 5, remember that you have your CNS, extrapyramidal, which are that involuntary movement, a lot of times with our mental health drugs, anticholinergic, which makes that dry mouth, those visual changes, those urinary retention, that sort of thing. Remember that there's also cardiovascular effects. Orthostatic hypotension is what we're dealing with quite a bit on the unit, so keep those in mind. GI effects. Now, your book talks about NSAIDs and GI effects. Also, aspirin can be very caustic to the stomach. So keep in mind that we need to be able to advise patients to take some medications with food. NSAID, my father last summer, he took ibuprofen too much. He ended up with a perforated gut. Never really recovered from that. So these medications can be very serious. And some, however, prevent these side effects. Pantoprazole, you know that's Protonix. Just about every patient in the hospital is on pantoprazole, either IV push or oral. And it's because the research has shown that patients who are in the hospital are underneath stress. And if we don't address the amount of acid that's going into the stomach secondary to the stress response, these patients within 24 hours demonstrate a hole in their stomach secondary to how much acid there is. So pantoprazole, that proton pump inhibitor, stops that pump from putting acid into the stomach and making it dangerous for your patient. So Protonix, when it's given IV push, you actually have to reconstitute it and shake it and push it over 2 minutes because it can be dangerous for the patient's veins. So those are the types of things that we're looking at when we talk about adverse effects. Hepatotoxicity and nephrotoxicity, you can all appreciate that, along with anaphylactic reactions. We talked about allergic reactions and immunosuppression. And so keep in mind that there are medications that will work together or will counteract each other. And let's see what you have here in your, I am on page 72. If you think about taking your benzodiazepines, and if you take that with like a pain medicine, which they have your hydrocodone, acetaminophen, Vicodin, you can have a CNS effect, fall risk. Many of our patients are fall risk because of taking too many of these types of drugs. I'm taking a look to see. I always like to remember that over-the-counter medications also can inhibit with them, but food is a real classic one that we need to focus on with our patients. Now, page 73 talks about, of course, today on your final exam, there is the whole tyramine thing in MAOIs. But also, you know that vitamin K, not potassium, vitamin K can counteract warfarin. So patient education about warfarin is about not consuming those green leafies that have vitamin K. Also, we don't want these patients on warfarin. Remember, that's Coumadin, but we don't use the brand name. Warfarin, they're not taking aspirins because they're on bleeding precautions, right? And so those types of things are really important. Grapefruit juice is a very classic example that sometimes gets in the way. Another thing I want you to think about with foods and with your medications and patients, furosemide. Name brand Lasix, but furosemide, the medication, which is that loop diuretic, potassium wasting, right? So we need to make sure that these patients who are on furosemide are getting the amount of potassium that they need. So if they're not taking furosemide with a potassium supplement, which is a huge horse pill, so a lot of times we break it into 2, or crush it and put it in applesauce. If they are not on a potassium supplement, we need to make sure we teach them about things like bananas that have potassium-rich sources so they can get that potassium that they need to make sure their heart is working appropriately, correct? So all those types of things are things you should keep in mind as you go forward. Now, you all appreciate the different categories of drugs and the teratogenous effects of a drug as well. So that's Chapter 5. Let's finish Chapter 6, and I'll publish this video. Remember that there are individual considerations. Body weight, you know your PEDS are going to be calculated by body weight. Always remember kilograms to pounds. 2.2 is the conversion, right? And so all those types of things are there that will affect the distribution of your medications. Also, remember with our older patients, start low, go slow is a great line that you're going to hear a lot, and when you get to Gero, the class of Gero, you're going to learn that a little bit more. But that really is true, because those older folks, they have slower metabolism. In addition, when they have surgery, it can take a month in order to get the effects of that type of medication out of your system. And so older adults need to have special consideration. And you all know that pregnancy and lactation also come into play as we are thinking about individual considerations.